Thank you for taking time out of your busy schedule to view this presentation on youth engagement. We believe that the adoption of these core competencies into practice will improve the outcomes for children with behavioral health needs and their families. These foundational modules are developed to be viewed by family members, higher education students, paraprofessionals, and professionals. A list of resources and references have also been provided. This module will be presented by Hannah Raish, Youth Coordinator, and Julian Abadi, Youth Representative.
The New Hampshire Children's Behavioral Health Workforce Development Network is to build a sustainable infrastructure for the professional development of the children's behavioral health workforce based upon the core competencies and infused with the system of care core values and guiding principles. The need is for New Hampshire to have an adequate workforce and an infrastructure to support those who work with children, youth, and families. The New Hampshire Children's Behavioral Health Core Competencies were developed in 2011 by a representation of diverse stakeholder groups, including child-serving community mental health providers, family organizations, state policymakers, and university staff. The goal was that the competencies would be the first step in developing systematic and comprehensive human services development infrastructure. The competencies were developed using the system of care core values and principles as the foundation. There are 7 domains: family-driven and youth-guided practice, cultural and linguistic competence, childhood development and disorders, screening, assessment and referral, treatment planning, interventions and service delivery, systems knowledge and collaboration, and quality improvement. The competencies are organized for professional staff by levels of knowledge and skills in each domain. There are 3 levels: foundational, intermediary, and advanced. The levels are designed to identify the skill level of practitioners. They are fluid and not specifically tied to certain formal education and training or position titles. A copy of the report can be accessed, and a link is provided at the end of this presentation. This is one of a series of modules designed to support the development of core competencies in the children's behavioral health workforce.
This module aims to educate adult allies and support staff about proven strategies for meaningfully engaging young people by empowering them to become partners and leaders at home, school, and in their communities.
As youth leaders and advocates, we also think that it is important to define the term youth-guided. Youth-guided means that young people have the right to be empowered, educated, and given a decision-making role in the care of their own lives, as well as the policies and procedures governing care for all youth in the community, state, and nation, which includes giving young people a sustainable voice and then listening to that voice. This is precisely the mission of Youth Move New Hampshire. We strive to advocate for youth right and voice in mental health and other systems for the purpose of empowering youth to be equal partners in the process of change, while also coaching others in the area of authentic youth involvement.
Youth-guided organizations are important because they can create a safe environment which enable youth to feel more confident and independent within the confines of their own cultural beliefs and values.
Being youth-guided means that youth are able to share their voice and perspective based on their individual levels of understanding and maturity. In order to be most effective, this process should be both fun and worthwhile.
If youth-guided efforts are to be successful, they must always include meaningful roles, voice, and choices, and power for youth at both the individual and systemic level. Adults facilitating in this process should be familiar with strategies for meaningfully engaging all different kinds of youth.
In the following slides, we will detail the core competencies for working with youth who have behavioral health challenges as outlined by the New Hampshire Children's Behavioral Health Network.
Adults looking to support youth-guided efforts should understand and value youth as experts on their own goals, dreams, strengths, and needs, youth as equal partners in both their individual plans and systems change work, youth's cultural preferences and norms, and finally, the value of acting in partnership with youth at all levels, individual, policy, and community.
In terms of foundational skill sets to support youth engagement, adults should effectively engage the youth as an equal partner in decision-making and implementation of plans, respect and acknowledge the perspectives of youth and what is needed and what works best, even when it contradicts traditional treatment models, and create opportunities for youth to be successful and resilient.
Adults should also provide youth with relevant information and data to assist in decision-making, practice open, honest, and sensitive communication skills using youth-friendly language, jointly set goals and desired outcomes for treatment with both youth and family involvement, include the youth and their family in monitoring their treatment plans, assist the youth and family in understanding their rights and responsibilities in designing and receiving supports, and also explain any relevant grievance policies to youth and their families and ensure that all families understand the manner in which grievances can be addressed.
Supporting adults should be sure to first understand the importance of youth and families as equal partners and leaders in organizational or systems level change efforts, but also place value on the youth voice and perspective in the design, implementation, and evaluation of service system and policy level work.
In order to best promote youth leadership, facilitators should share information about youth leadership training and support youth participation in such events, promote and encourage youth and families to provide input, feedback, and participate in decision-making, and also link youth and their families with accessible leadership opportunities.
If a facilitating adult hopes to be successful in engaging an individual youth, they can implement some of the following proven strategies. Active listening to the youth's own story of their history and their hopes and dreams without interruption or correction to ensure the youth's voice is primary. Graphic facilitation. Creating shared agenda setting for the young person's meeting. Remember, it is their meeting. Encouraging youth to bring to any meetings those people most important to and trusted by them. Food and fun incorporated into any gathering will be sure to make them more productive, and engaging the youth in the tracking process, but then also shifting gears when it becomes necessary.
It is important for supporting adults to remember the work at hand is youth-led and adult-supported, not youth alone. When you are working with youth, you must clearly state the goals and expectations up front, and then organize systems, trainings, and supports focused on those goals to help youth achieve the expected outcomes. Adults are there to provide structure because youth are capable, critical thinkers, but are not as successful when they start with an empty slate. By giving them a structure or framework within which to be creative, you can improve outcomes exponentially. Be sure to provide ongoing support while also holding youth accountable. Check in with them, and if they are not succeeding, find out why and offer support that they need to succeed.
Retaining youth can often be a challenging task, but by implementing proven strategies for engaging youth leaders, you are more likely to achieve better outcomes. By setting a time limit on a project, being realistic about specific goals and outcomes, engaging youth with an action-oriented strategy, being upfront about the commitment they are making, and outlining a process for sustainability, the retention and engagement of youth leaders will become much easier for the facilitating adults.
Providing youth with incentives to participate in system-level policy and planning work may require funding to counter missed work and cover transportation costs or childcare. It is important that supporting adults consider using both financial and social incentives to engage youth leaders. It is even more important to bring youth to the table in meaningful ways with expectations for tangible outcomes, rather than just using them to fill a seat.
Youth leaders are also incentivized by being recognized for accomplishing both big and small goals. Recognition can range from a simple "congratulations" or "nice work" to a more formal award ceremony. Sometimes youth also like to be recognized as a part of a bigger cause or initiative, rather than solely at the individual level. So providing them with materials which promote their group and helping them to brand themselves can be a useful tool for engagement.
We would like to end our PowerPoint by giving credit to each person who helped in the creation of this presentation, and we would also like to thank you for your time. Please check out the other presentations that are posted for more information from the New Hampshire Children's Behavioral Health Workforce Development Network. Thank you!